no power like the power of the people, and the power of the people won't stop. Hey, ain't no power like the power of the people, and the power of the people won't stop. Hey, okay. So remember that, because you're going to have to practice it a bit. This is the again. We're here on the steps of the legislature. So we are here today for two reasons. One is to say thank you. Thank you to healthcare workers. Doctors, nurses, and all of the staff in all of the disciplines and support services who have supported the ability of our healthcare system to deliver vital services to Albertans in their hours of need. Thank you. May not believe it, but today is day 794. 794 days since the World Health Organization declared COVID was a pandemic. 794 days since our world changed. 794 days of courageous self-sacrifice, exhaustion, and dedication by healthcare workers. There are two very small words: thank you. Thank you for all you have done. From the bottom of my heart, I thank you for what you do every day for Albertans. And there's a second reason we are here. We're also here to say public health care, not just public funding, but public delivery of health care is important to us. It is essential to our common good. Yes. I have no buttons. I should have brought some no buttons with me, because that's the simple statement. No to private health care. Right? And we've been here before. This is a good crowd. There's kind of a fun sort of atmosphere to here today. This is the first of our, Defend Medicare rallies. It's certainly not going to be our last, I'm sure, because we have been here before. Literally, we've stood on these very steps when Ralph Klein tried to lead this province down a path to privatization. Yeah. Remember the third way, anyone? We said no before. We know the international evidence does not support traveling that road, no matter how much those who would profit from dismantling our public health care system would want us to believe that theirs is a better way. It's a better way for them, but it's not a better way for us. And of course, there's the same old arguments. We already have private participation. We should not fear a little more, like private surgical centers. They want us to ignore the fact that governments at the provincial and the federal level have intentionally undermined public health care, created the atrocious reality of long-term care. They've intentionally, slowly been foisting inferior conditions and payment onto individuals and family. They want us to ignore that they have intentionally devastated and alienated our healthcare workforce and then offer private solutions as the answer. We weren't fooled. We weren't fooled by Ralph Klein, and we won't be fooled by Jason Kenney. Of course, a frontal attack would never be successful. Our public health system needs to be starved and dismantled bit by bit for them to succeed. Who are they? Well, we talked about them 20 years ago. The zombies, the undead promoters of private health care, salivating when they imagine the profits they want access to. 20 years ago, I talked about the healthcare wonder pig. It's a metaphor, and I'm going to say it again, because I think it's really an important way of understanding and sort of connecting how undermining one system is so important. So this is the healthcare wonder pig. There once was a farmer who had a certain pig of which he was very, very proud, just as we are proud of Medicare. This farmer also had large fields, many heads of cattle, and several other pigs. But other than his wife and children, he loved nothing as much as he loved this special pig. No one could expect to visit his farm without being shown the pig, nor could they escape without some story of the pig's most wonderful deed. One day a traveler happened to stop at the farm and asked to see this wonder pig of which he had heard so many stories. The farmer, of course, was more than pleased to oblige. As they walked towards the barn, the farmer told the traveler how the pig rooted him out from under an overturned tractor and saved his life. He told the man about the night the pig had managed to alert the family to danger and saved all of them from being burned in their beds. He told him about the time the pig saved his youngest son from drowning. The pig, like healthcare would seem, had at one time or another saved every member of the family, and they were all in her debt. The traveler was taken into the barn and could see that back in a very cool area was a very clean, well-painted, and a very special pen. And in this luxurious pen, he could see the wonder pig. But the poor pig was missing an entire hind leg. The concerned visitor asked the farmer what terrible misfortune could have befallen the pig. "No misfortune," answered the farmer, "but a fine pig like that, you can't butcher all at once."
Right on.
Right. That's just what is happening bit by bit. Erode, undermine, defund, and destroy. We know what the forces of privatization want to achieve in this province and in this country, but we are not blind. We do have the power to set the course and determine the path we travel. We know what is the better way. We have been here before, we've done that, don't want to do it again, shouldn't have to do it again, but my friends, I will, and we will do it again.